Tonight, we will hear the story of Karen and her journey with COVID-19. To protect her privacy, she has chosen to wear a scarf and sunglasses, and her voice has been distorted. We'll also hear from two medical professionals who spent some time talking with Karen. They will offer their assessment, advice, guidance, and takeaways, which were all shared with Karen and will be shared with us tonight. We cannot continue without acknowledgement of the senseless violence being perpetrated at the hands of law enforcement. We stand in solidarity with our community, and we demand justice for George Floyd. What an emotional issue. George Floyd, we say your name. And now, Karen's COVID story.
I live in LA. I'm in my 30s. I started being sick the second week of March. It started with sweating and fever. In the morning when I woke up, I thought maybe I'll get better later on. So I decided to still go to work. I kept working, and after 2-3 hours, I started sweating really, really bad and being shaky. I fell on the floor at work because I was too weak. So I decided to clock out and just go home. By the time I arrived home, I decided that I'm not going to drive myself to the hospital. I'm simply going to call 911. When I was on the phone, they were asking me questions. Why I think I should be picked to go to the hospital. And I told them because I'm not feeling well. I'm usually not like that. I'm not a person who is usually sick. I'm shaking a lot, I'm sweating, and I think I'm having fever, maybe not very high, but I'm having fever. I can feel it. And they asked me what race I was. I said I'm a Black person. Then they said if there's anything else that they need to know, if I've been out of America recently. I said, no, I haven't been out since 2017. I told them to please just get me people to come get me. And they kept asking why. So I kept telling them the same thing. In the car, the ambulance, they were asking me questions about my insurance. And I told them that I don't have insurance because I lost it. A few months ago, I lost my insurance. So they said that they need my social security. And I told them that I'm going to need time to remember because I don't remember my social security. And they kept asking questions after questions. And then when I gave them the social security, they didn't ask any more questions. So we arrived at the hospital, and I heard them telling the people that they should cover themselves and not get too close to me because I have the virus. That's what they were telling the other people that were around. When we were in the ambulance, I told them that I have anemia and I also have very low white cells. Because I do multiple jobs, and all of them today are being called essentials. They're being called frontline, the three of them. Because of the places that I work, I think I should be tested. The lady looked at me and she laughed. After that, she said, no, we're not going to get you the test because it's only for the elderly and we have to keep them because we cannot waste them. Then she asked me if I had some other symptom. I'm having like hallucination. The way she says it told me that it's time for me to go see a psychiatric if you want. You know, so we are humans. Sometimes when people talk to you, they don't have to tell you what they have to tell you, but by the way they're responding to you, you know the answer. She said that she's gonna go get me Tylenol and give it to me. My head was pounding. You know, I had severe migraines. She asked me, what kind of cough do you have? I said, I'm not coughing. I told you already that I'm not coughing. What I saw is they were looking for a cough, but it wasn't any kind of cough they were looking for. They were looking for a dry cough. They said, if I have any kind of dry cough, I said, I'm not coughing. All I have now is a little bit of a sore throat. I'm feeling shaky and I'm feeling like I'm going to go mad because of the things that I'm seeing. And also I told her that my toes are itching me. You know, I usually don't have itchy toes. But she said, no, that is none of the sign of COVID. I said, I'm not looking for COVID. I'm looking for you to help me feel better. They came and they said there's nothing wrong, I should go home and quarantine. I said, okay, but I repeated to the lady, do you know that I don't have enough white cells also, and I'm also anemic? She said that you're gonna be fine because you're young, you don't smoke, you don't drink. You should go home and quarantine, just like the doctor said to tell you should go home and quarantine. I was very shaky, I was sweating a lot. I remember when I arrived, I took off my top and changed it. And before laying down, I went to my pharmacy, my little pharmacy in my bathroom, and I got as many medicine as I could to put it under my pillow so I don't need to stand up again. So I have water close to me too. I didn't need to stand up because everything was nearby me. You know, I was very fearful when I was diagnosed with a low white cells. My doctor, we used to joke a lot, and they used to say to me, you know that if you catch a virus, you might not survive it. And we were just laughing because to me, that's how we laugh when I go see him, you know? So I kept remembering that. So when I called two of my friends and they said, okay, we're going to bring you food. I even lied to them that I have a lot of food at home. It's not necessary because in my head, I was going home and I might not see outside anymore. You know, I thought that I would not survive because of the job that I had and the high risk that I knew I was exposed. To me, I really thought that I think I have that thing. I was scared about my low white cells. Am I going to be able to fight that virus? No, I don't think I should have been sent home. Not at all. I think that if they really didn't want to keep me, at least keep me there for at least 4 hours, just to give me some fluid, you know, IV, something like that. You know, don't send me home with a Tylenol and then a few days after send me a bill of almost $4,000. I can go give you back your Tylenol. Tylenol don't cost that much. I should have stayed at the hospital at least for a day. When I was sick, if you weren't someone that is famous with a lot of money, even some famous people were complaining they couldn't get a test. I remember when they were saying that everybody can get tested. When I was feeling still good, I decided to try it around April. And still, they wouldn't let me. They were still saying it's for elderly people. So I think it became easy like 2 weeks ago to get a test. I hope that the healthcare will learn from the COVID-19 how to treat people better, you know, how to give people insurance, because human lives, it's more important than money. You know, save the humans. The insurance, we can find ways of paying it. You know, once you save us, we get better, we will go to work and we'll pay back your money. It's not about money, it's about being human.
Well, one thing that I've had to do is it's really education, and one of the reasons why I went into medicine is because my family experienced many healthcare problems, traumatic injuries that led to death, and I wanted to understand how can we make the system better so that people don't have to die. I've dealt with this as a patient. I've dealt with this with my family members. I've really learned who to talk to. I've learned that there are different ombudsmen, so I'm not saying that correctly. For hospitals, there's legal counsel in hospitals, there's hospital administrators, and you really have to call on those people if you don't feel that you're receiving the care that you need. So for Karen, for example, she could have refused to leave the hospital without further workup. So by the time she was admitted in March, we already knew that a CT scan was important for a patient to be diagnosed with COVID-19. So to advocate for yourself, you've really got to understand how this system works. Who makes the decisions? Yes, profit drives healthcare right now. We have to educate ourselves, especially in communities of color. We have to be able to question things. We had access to knowledge, and this far down, she didn't have to experience what she did. She was a near miss. That's what we say in medicine, a near miss. She could have passed away based on her symptoms, based on the fact that she was confused, hallucinating, and that's wrong for us to do in the US. I really do hope that Karen's story will really just, put a dart in our hearts, in our minds, in our moral conscience of this country. Help us realize that we can change. The way that she was treated was not okay. Everyone matters. And in healthcare, especially, like she said, when we take that Hippocratic oath, it is to care for everyone, regardless of their ability to pay, regardless of their religion, their race, insurance status, immigration status. Being human supersedes. So at this time, I think the thing that COVID-19 is showing us all is that we have to reevaluate what our morals are, what is our character.
For me, the biggest thing is just recognizing that we're seeing some of the worst facets of America just being repeated. I listened to Karen's story and just the lack of cultural competence from the 911 dispatch call, and all the questions, all the way to, the very, very first provider who walked in before the laugh, but even asking these questions about like substance abuse. I can't help but think about how in clinical research, Black women have been studied from a pathological perspective. Right now, we need to see the healthcare providers culturally competent and sensitive, especially if you see who's leading the numbers. The New York Times says it best. They literally said that COVID-19 has a predominantly non-white female face. If this is the case, then you know that you're going to need some cultural competence as it relates to serving the Black and brown population. And that's just really huge for me to know that, someone like Karen could have even benefited from having a spiritual advisor in the room, or to come in to visit with her, to get the chaplain in, to see how she felt about even being discharged, so soon. Just treating people based off of, what we think they have, or their ability to pay, or their insurance status. I think it's hurting us, but I think it's also killing people. And that's what's most important.
Wow, this is just a really powerful and emotional story. We want to thank Karen from the bottom of our hearts for sharing her story with us. Thank you to the doctor and our medical professionals for giving us their time to really talk to Karen and to help her with resources and just to allow her to express herself. As we know, it's really important for us to be able to tell our stories. We are really happy to see that she's recovered